Welcome back to the Academy Table. I'm Renee DeSilva, CEO of the Academy and your host. In this episode, I was joined by Mike McSherry, CEO of Xealth. Xealth is a platform that enables doctors to prescribe the digital tools that facilitate health. Mike is a veteran of the mobile tech space and a serial entrepreneur. He found his way to healthcare through Providence as an entrepreneur in residence, and that experience helped to shape the direction of his latest venture. There are two takeaways from my conversation. First, pay attention to how Mike discusses the power of Americans' trust in their clinicians. A doctor's recommendation is a key predictor of digital health adoption. But if healthcare and the industry fail to capitalize, that trust could shift elsewhere. Next, Xealth recently closed a Series B funding round that was 100% health system led. As Mike is a serial entrepreneur, I appreciated his reflections on the value of collaborating with investors who are also key users and partners of the venture. So with that, let's head to the table. Well, Mike McSherry, CEO of Xealth, we are delighted to have you at the table today.
Thank you, Renee.
So Mike, your Twitter handle description, which I really liked, is startup guy in Seattle, improving healthcare for doctors and patients. Maybe before we get into how you're animating around that, talk to us a little bit about how you arrived at the work that you're doing today.
Yeah, roundabout. I've done a number of tech startups. Xealth is actually my sixth startup that I've co-founded over the last 25 years. I got started at Microsoft in the 90s, but then jumped into doing startups from there, mostly in mobile and technology. And I sold my last company to Nuance. I was company Swipe, a touchscreen keyboard that was put on several billion phones. Now it's on every Android and iPhone in the world. I was casting about what to do next. I joined the board of a local hospital system in Seattle that merged with Providence. And through that, I met Rod Hochman and Aaron Martin, the CEO and chief digital officer of Providence. And they incented me to think about doing a healthcare startup. So they drew me into Providence as an entrepreneur in residence and gave me green light to think about any problem in healthcare, free range EIR, if you will. And we came up with the idea of Xealth through that process. I will joke that we cast aside 70 other ideas that illegal, immoral, won't work, nobody will pay for. I had to go through the litany of how to do something and navigate the labyrinthian, healthcare world, but we came up with Xealth through that process.
That's great. So entrepreneur in residence beginning in 2015, it sounds like that you had a wide swath of where you could focus. How did you sort of initially get to the problem definition or really figure out where you wanted to focus in the sea of things that you could have taken on?
Yeah. So again, we cycled through dozens of different ideas and quite honestly, they were mostly focused on prevention. I like to live a healthy lifestyle, and I've seen what mobile and wearable devices and other kind of consumer-oriented tools can bring to people's lives. And I thought more of that should be embedded into the healthcare processes. And we were embedded inside of a provider system. So we spent a lot of time on that, but then realized that providers aren't actually incented to focus on preventative wellness and healthcare and pay for it. So that was a rude awakening to us. But specifically to Xealth, we were mobile guys. We saw the patient portal. Epic was opening up their SDK on their patient portal to build a custom branded MyChart experience for hospital systems. And we started there. And quite honestly, back when we first started it, systems were saying, well, why would I care about a better mobile patient portal? Is it going to make me money or save me money? And that was kind of a rude awakening because anywhere in the consumer world, you build a better user experience, and immediately it's representative of greater consumer demand and usage and business model evolution and creation. And that was whoa, healthcare doesn't care about user experience? Geez. But we kept iterating on that, and we saw the pilots that Providence was trying to do and bring forth these third-party experiences into patient adoption and recognized how broken that was, and it wasn't embedded into the patient experience in a formulated manner. And then we also recognized, well, it's not embedded in the clinical experience either to recommend or prescribe or then subsequently monitor these tools. So we architected an end-to-end prescribe, deliver some third-party solution to a patient, and then subsequently monitor that patient's usage of that app or device or content consumption back into the clinical monitoring. And then we recognize that this is a pretty big idea to have a closed loop prescribing engine for digital health.
Interesting. So it is always funny to me, the surprises that emerge when entrepreneurial folks, maybe folks that have a technology background, enter into the healthcare context. So for you, some of the bigger surprises, it sounds like, were business model, sometimes preventing getting to the innovation the way that you were trying to drive it, a little bit around, at least taking us to that period of time, and probably still today, healthcare just not being quite as consumer centric. And that in many ways, that's sort of where you had to go to really begin to accelerate that. So once you had that view, I wonder from a physician perspective, because I think so much of what you're trying to do too is anchored around, and I loved that you started with that, improving healthcare for doctors as an enabler of that. What did you learn from physicians who wanted to use digital health therapies in some of your early rounding when you were serving in this capacity?
Great question. Physicians are, let's face it, they were some of the smartest people in school. They're polymaths. You meet people that have their medical doctor, they have an MBA, they have a PhD in a different discipline, and they played world-class piano. You're like, Jesus, do you enjoy a beer on the weekend?
Right.
They're brilliant, and they want to deliver the best care for patients, and they want to dabble in, some of them code, and they really want to engage these digital experiences. But frankly, it's the business economics of provider systems that hold them back oftentimes from adopting some of these digital tools and engagements with patients. We found ourselves talking to clinicians, and we'd set up a meeting. Oh, let's meet the chief oncologist of Providence. Well, he'd pull in 5 of his other oncologists, and we'd sit and brainstorm for 60, 90 minutes and realize I know nothing about this. And unless one of these people are willing to quit their jobs and go on a journey with us to create some startup, I'm wasting everyone's time. So that led us to thinking more about back to software and core roots and how we could improve some of their lives using software tools versus trying to build a disease-specific, kind of solution. And that's kind of where we needed to find using our consumer-oriented experience and building engaging experiences, but also building into a need for someone on the other end, be it the patient or the clinician. And frankly, I think we found a really sweet spot of improving clinician lives in terms of efficiencies and engaging patients the way they think is necessary, but also providing a more easy and seamless and an engaging, convenient manner of digital adoption for the patients. So hopefully this trend is going to continue, and we've built a sweet spot of the triple aim: reduce costs, better clinical experience, and better patient experience and outcomes.
I love that. Getting back to core roots as the way to really drive it forward is a powerful sentiment. Let's go from the consumer lens. I think we've all noted that perhaps we've seen less adoption around healthcare digital tools than we have in other segments. So I wonder if that rings true for you, if you have a different perspective on that, but just any parallels that you've observed from consumer adoption of digital health that you saw outside of healthcare that we should just think about in the realm of the healthcare ecosystem.
Yeah, so I referenced being involved in the mobile industry earlier. I co-founded Boost Mobile, which is now Dish's nationwide prepaid network. And so I was there at the advent of the App Store. And I think digital health right now is probably akin to early days of the App Store, where most digital health is actually consumer adopted, direct to consumer. Someone goes to the App Store and downloads an app because they're worried about their weight. They're worried about their anxiety. They're worried about their stress. They're worried about their hypertension. And that's consumer directed. And where you're now starting to see the evolution is the changed business models that go along with that App Store. And that's the advent of Uber or Facebook or Airbnb, where these massive third-party companies built on top of the core infrastructure enabled by those app stores, if you will. And I think when you bring all of that forward, you've got payers adopting digital health and employers and consumers, all because they care about the capitation, the risk, as well as their own personal journey in improved health and wellness. And you've got the hospital systems largely due to business model holding them back from broader adoption. But I'd also say there's some paternalistic viewpoints towards it, and the consensus or the business model of, well, you should come back and see me in 6 months. You should come back and see me. You should come back and see me. It's all driven around an RVU-driven patient visit in a face-to-face environment. And I think that's what's going to crack open, is a lot of that can be done asynchronously, more on a daily monitoring basis against an app or device or some other RPM tool against patient experience. And that's going to radically transform the healthcare business model over the coming years, I'd say.
I'd agree with that. Do you think as an industry, we are beginning to see proof points of, if I am more engaged as a patient, that my outcomes are better? I know that you're amassing significant amounts of data. You must have access to some of the more interesting metrics or data. I'm wondering if there's any early data on that would make us all feel optimistic.
Yeah, we have tons of data, and so let me back up. Xealth's business model is we let clinicians, hospital systems prescribe digital health tools to patients. Patient engages with that app, that device, the consumption of that content, answers that questionnaire, whatever. And then we bring that data back into the clinicians to monitor and intervene if some of that data is trending in a negative kind of capacity where the clinician needs to intervene for greater acuity levels of engaging that patient. So that's our core business. We've integrated 60 different vendors into that workflow on behalf of our customers. So we say we manage the digital health formulary for our provider systems. Some of the data, behavioral health, Silver Cloud, it's a behavioral health app that we've prescribed out to tens of thousands of patients across different systems. Generally speaking, of the prescribed app to a patient, about 2/3 of the patients enroll in that app. They actually download, register, and use that app. And of those 2/3, almost 75% have improved PHQ-9s. So they're depression screenings of how they're doing. And so we're correlating that is to improvement in PHQ-9s. We're doing the same thing in diabetes management with a number of A1C readings and tools. But it's not just specific disease state, literally 10x the number of advanced directives on file into the EHR. And we've improved the smoking cessation rates at Duke by 20x from what they were doing before. Crazy improvement in numbers, all because of digital automation and recommendations to patients against disease state management or things that you want them to do. And some of the things you want them to do is just come into surgery better prepared, better informed, which leads to improvements in the readmits and the satisfaction rates, et cetera, along those lines. So it's not for us to define the problem or the use case or what the clinician or clinical service line is trying to do with the patient, but we digitally facilitate that entire end-to-end experience.
And what's so lovely about that, and maybe you said core roots, but back to the core root of, if you think about where most of the trust rests within the broader economy, it is patients with their physicians. And so the ability for you to just take friction out of that and innovate from I'm going to write a prescription on my paper for you to take to the pharmacy. I loved what you said, the digital health formulary for the future. It's in some ways a powerfully simple concept that has the potential to really move wellness in a way that is exciting to see. So excited to continue to track that. I wonder, anything counterintuitive that you've seen from some of this work from a consumer perspective, or you mentioned 60 different vendors with whom that you've currently engaged with. Anything that's been noteworthy, counterintuitive, a big surprise for you or your team?
Yeah, and let me go back to an earlier comment, then I'll touch on this. I mean, you said the digital formulary. SureScripts is a e-prescribing platform for meds, and 20 years ago, or even 10 years ago, doctors largely used to handwrite a medication prescription on a piece of paper that someone would physically take into a pharmacy. And that's largely how digital health or, wellness recommendations are being, offered today. Like, oh, you should go join a gym. There's an app in the App Store. You should probably try and find one and download it and see which one works for you. And it's sort of this verbal communication in this world of digital health. And we say that we digitally facilitate health. And the reason I say digitally facilitate health is because we've done transportation for patients. We've done a number of meal delivery services. We did Kroger quarantine kits for COVID positive patients. So these aren't digital health services per se, but we digitally facilitate that. And the more that hospital systems accept capitation exposure, the more that these health and wellness and preventative services will play a broader role in some of the activity of things that a clinician might refer or prescribe or recommend to it. And I personally, back to why I jumped into healthcare, I want to see more prevention and the business models focused around preventative services, because I think that'll go towards eliminating a hell of a lot of the cost on the repercussions of that lack of prevention up front. Wellness versus sickness management, if you will. Now, you also asked a question about counterintuitive things. I did not know the level of trust of the doctor. So, back to digital health has largely been adopted by payers and employers and consumers. We've got a number of data points showing 4 to 20x higher adoption rate against a comparable app or service when it's the doctor recommending that to the patient or the clinician. It could be a nurse or MA. So when the clinician is recommending that tool or program for the patient, 4 to 20x higher adoption than member marketing or employer directed or whatnot. People trust their doctor. We generally, we prescribe something to the patient. We send an email, we send an SMS. Hey, the doctor wants you to do X. We get upwards of 80% open rates on a lot of those emails. It's a message from your doctor. No direct mail campaign gets that. So I just did not recognize and realize the power, the trust of that doctor recommendation. Obviously, pharma has loved the doctor recommended for decades now. But in the world of digital health, patients are clamoring for more information. They use Dr. Google. They're downloading apps in the App Store. And I think actually that it's an abdication of responsibility to some degree that clinicians aren't stepping in with more digital recommendations to engage patients, because obviously patients are clamoring for it, and the capitated business models are liking the reduced cost and increased convenience associated with that. So clinicians need to do more of it. The systems need to do more of it to meet patient expectations. Otherwise, patients are going to take that trust and convenience expectation to new entrants or the payers or other kind of care providers, if you will.
I think that's incredibly well said. So let me change gears a bit and congratulate you, as Xealth just completed a Series B raise. I think it was 24 million, 100% health system led, which is maybe an atypical structure. So tell us a little bit around why that structure was important to you and how that came to be.
Yeah, thank you. Thank you very much for acknowledging it. And in fact, it's 25 mil. There's another system, very large IDN coming in that'll be announced shortly. So we're pleased with that now. So that's 15 provider systems as investors, plus I have 5 other strategic investors: Cerner, McKesson, Philips, ResMed, Novartis. So I would use all of the strategics to say that the entire industry wants to see a platform developed to take the fragmentation out of digital health and remote patient monitoring and build a standardized solution. And I think this was a huge vote of confidence towards Xealth as that standardized solution for the provider industry with all the strategics backing it. 20 strategic investors, that's a lot. But I've referenced this is my 6th startup. Every single one of them was a joint venture from day one, or the first money in was strategic. My last company, Swipe, was Nokia and Samsung were my first 2 investors in the company. So is
that just your mindset? So just to pause on that for a second. So that's sort of your playbook, the way that you approach it is, that's just back to core roots or principles first. That's naturally where you go.
Yeah, Boost, which I referenced earlier, was a joint venture with Nextel. I solve problems, and the people I solve those problems for, I would rather have their dollars invested in me than random venture capital money. Now, venture capital plays a huge role and helps scale and growth. And I do have I do have a great VC lead in the company, but I'll call them governance around my strategic. And when I say governance, financial governance, no favoritism to any of these strategics. It's neutral governance around a sea of strategics. But I've built my career on solving problems for enterprises, and so much so that they want to invest in my success and my team's success. And I would rather their dollars, along with the conviction of that organization that we're going to be their standardized solution, play a role in how I create these businesses. Back to Skype, Nokia and Samsung were the number 1 and 2 phone manufacturer in the world. And when they invested in us and deployed my software on all their phones, the rest of the entire industry adopted that. And I want to be the ubiquitous solution. I want to have that ubiquitous digital health prescribing and monitoring platform across the US provider base. And on that monitoring, ultimately, I think we're going to have the benchmarking of digital health effectiveness. And the recommendation of an app isn't going to be on a subjective basis. It's going to be on a quantitative basis based upon all the data that we're collecting on the improved outcomes of apps against patient demographics, psychographics, comorbidities, et cetera. Something needs to standardize all of that data into improvement on recommendation algorithms and outcomes and cost containment ultimately. And I think that we're going to be the solution that fills that role.
But what I love about your most recent round, and I will admit my own bias here, is that the providers have such a power to move market share. And in many ways, they have, we talked about the trust that they have. In many ways, they serve as the de facto public health entity for their communities. They have such the ability to shift how this plays out, and seeing them come together. It's a lot of what the work that we do at the Academy is around this, having them come together to really figure out how you can coalesce as an industry to move and accelerate the pace of change more quickly. In this case, what we're talking about, I love that story. And just really, it's interesting to me to see how there's more and more examples of this, whether it's Civica or Truveta and now Xealth. There's this notion of providers really shifting market share in a way that drives better outcomes for patients, which lands well for us at the Academy.
Yeah, well, and this is where I give props to the Academy. You were hugely influential in this fundraising round for Xealth. You've been an esteemed organization, have the trust of the providers. You bring together cohorts around different disciplines, be it financial or medical or academic elements of care delivery, and with providers as your member organizations. Now, with that, we were incubated inside Providence, and we spun out 4 years ago. And we had several systems invest in us earlier: Providence, UPMC, Cleveland Clinic, Atrium, et cetera. And then as the Academy, I think, successfully helped launch Truveta and galvanize and coalesce a number of provider systems around it. Also identified, wow, there's a lot of fragmentation in the world of digital health and RPM. Provider systems should centralize around that notion as well. And in conjunction with Academy, you guys helped bring a number of these new systems as investors and commercial partners to Xealth to the table. And so I like the role that the Academy is doing, identifying open needs for provider systems and how providers need to modernize or coalesce into standardized solution sets to better compete with the payer dynamics at national scale. And we were the beneficiary of some of your learnings in that need for a standardization in the world of digital health.
Yeah, well, thank you for that. I also think your comment earlier around if we don't approach it this way, the greater fragmentation will certainly be present. And then I think that puts us all as an industry at risk for just greater disparity in health outcomes if you are not finding a way to stitch this together in a common patient experience. So as you talk about digitally facilitating health and that really having an impact on transportation or food or other things, that is a key factor in health. I love how all this is coming together. So excited to continue to watch your journey here.
Yeah, and I mean, your members are our members. We are a provider-oriented software solution, and so the greater success we have, the greater success that your members are going to have. And you mentioned that provider systems are in public health. I mean, they're part of the social safety net. They can't just go away, but they need to modernize on patient experiences. Otherwise, they become just the high acuity and ER visit kind of oriented stops for patient care, because patients and the folks underwriting the insurance market in the US are going to seek quality care at low cost delivery. And if these expensive inpatient service delivery of providers can't modernize to meet that low cost, quality, convenient facility, they're at risk of losing a large part of their commercial market share.
That's right. One thing that we haven't talked about, maybe I'd like to touch on this before we wrap up, but what do you see, or are you trying to activate anything similar just from a government perspective? So if you think about back to radically getting to greater adoption, just I think 40%, if not upwards of that, of most reimbursement comes from government payers for the average health system. Are you at all trying to start to have that conversation around getting better reimbursement for these tools from government payers?
It's a great question. We're probably too small to sit in the government lobbying realm, but my provider systems, my customers, frankly, should be. I think there's a huge disservice in this country right now. There's a huge inequality exposed right now because every employer, every insurer has digital health tools. They've got an app for behavioral health, for diabetes management, for hypertensive, for COPD, and yet if you're on Medicaid or Medicare, you're still expected to go in for that face-to-face visit. Oh, sorry, nothing's covered for you. Why don't you come in and schedule a face-to-face visit with me in 3 months' time? So the lack of quality, digital, convenient tools that are providing effective, results is a huge challenge in disservice to those that are especially the most disenfranchised in the country. And I think that's oversight for CMS to not underwrite more digital health activity. You're seeing it in Europe, Germany, Scotland, part of NHS. The government pays for digital health tools for all of their covered lives in those countries, whereas in the US, CMS has been a laggard in an adoption of that. And I would like to see that changed for better patient improvement across all patient populations, not just the commercially insured.
All right. Well, let me ask you one final wrap-up question that I tend to ask all of my guests. So a big part of the impetus for creating this platform and calling it The Table was just the power of conversations to move thinking. I think it's one of the things that we've all missed in COVID times is it's just been harder to gather together, although that is beginning to shift. So my question for you is, if you were curating your ideal table and could invite any two people for a conversation, who would you invite and why?
Wow. I'm going to bring in from two different realms here. I have a foot in the past in pure technology and the disruptive nature of technology, and then a foot in the traditional paternalistic world of healthcare, wanting to move care delivery forward. And so with that said, I would love to see a dinner conversation between Jeff Bezos and Atul Gawande. I've met Jeff. I haven't met Atul. I don't know. But I say that Jeff and Amazon would bring a siege warfare to healthcare. They've got PillPack. They've got Echo devices in people's homes. They now have wearables. They've got Prime. They've got home care delivery. I mean, they're just bringing 20 odd different business units to the table on bringing care quality to the U.S. healthcare system. And with that, it's just relentless focus on cost, quality, and patient experience. And cost and quality and convenience will trump everything. That's their point of view. Whereas someone like Atul Gawande would say, well, where's the human empathy? Where's the doctor prescribed? Where's the recommendation? So is the face-to-face, paternalistic, empathetic care delivery going to win out versus a more mechanized cost, convenience, quality trumps everything? And I think that would just be a fascinating debate, because healthcare is not one side or the other. It's going to be a meeting in the middle, but certainly you have to come at it from a point of view, and we'll see where healthcare gets delivered in the future against those two different domains.
I think that'd be a fascinating conversation, and we should ask Jeff to pick up the tab if that were to indeed happen, for sure.
I saw that William Shatner went to space today on Blue Origin, so congrats to his dimensions of exploration in all dimensions of the world now.
Indeed, indeed. Although I said that was going to be my last question, I have to ask you one other thing, just given how prolific of an entrepreneur you've been. So are you always thinking, I'm just curious how people who can conceptualize de novo, white sheet, 6 new concepts, and at least the few that you told me about, several of them were incredibly successful. Is there anything about your system, your process, how you get at that? Or is your mind just sort of constantly ideating and things just come to you? Is it process, or is it a little bit just maybe in your DNA, just sort of how your mind works?
I'll go back. 4 were great successful outcomes for the company. One was raised $400 million and went bankrupt. It was in telco, and they did huge swings and bets, and that one didn't work out. And now Xealth is on a presumed path to success. So 5 out of 6 ain't bad.
That's not bad. I would take those odds.
I am not constantly iterating and tinkering on new thoughts and ideas. Once I get into one of these, startups and companies, I'm all in. I'm not thinking about other industries at this point in time. I'm solving healthcare delivery problems right now. And to come up with that idea in the very first place takes months, if not years, of exploration around an idea or concept. And I went back to, I had the luxury of Providence hiring a team in IN, my Swipe executive team, 4 of us. And we were a product team with an engineering, capability, and we could build prototype. And we built prototypes on, frankly, a dozen of these different ideas. And we chopped the prototype around to the clinicians or the payer side of providers, or talk to external third parties. And so you just need to tinker and tinker and tinker. And it's all iterative development. Again, we started building a mobile app, but I didn't want to be an app developer. What more could I add to that experience? And then we became sort of this middleware solution of prescribing and then monitoring third-party apps and tools. So it's an iterative tinkering process that, is born of curiosity. I'm just fascinated. And I've read dozens of books in healthcare and care delivery and the business economics of care delivery now, because I'm all in on care, and I've had some success, and I wanted to just give back. And I think it's a huge, it's frankly the biggest challenge to the ongoing prosperity of America is the care delivery and the inequity associated with that. And I think technology can help solve a lot of those problems, or at least raise the rising tide lifts all boats, and at least bring up some of those who don't have access to care quality right now. And that's what I'm trying to solve, and hopefully Xealth is on a path towards achieving that here in the industry.
That's fantastic. Mike, thank you so much for your time. I'm delighted that you're able to join us today.
No, thank you very much, Renee. I appreciate it. And thank you to the Academy for all that you've done in helping Xealth get a leg up in this industry.
It's been our pleasure. Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.